Everyone, my name's Lucy Kitson. I'm the primary care team lead for the primary care link workers in York. We work in surgeries, but what I thought was I'd just kind of give you a little bit of background as to what social prescribing is. So social prescribing first came about in about 2010 after Public Health England and the NHS asked somebody called Michael Marmot to do a review of the health inequalities in the UK, and this report that was published, which is accessible online, just showed huge gaps really in quality of life for people, also life expectancy. So he fed that back to the NHS, and the NHS kind of formulated a plan, which is in fact the long-term plan. And this is where social prescribing came in. Basically, they've realised that prevention, support for long-term conditions, and re-establishing community was key. It's not all just about medicines and things like that. A lot of issues people go to the doctors for, obviously, could come from anxieties in regards to housing or being lonely or feeling isolated. And that's where social prescribing's come in. The first social prescribing offer in York started in 2015, and that was based at York CVS, and it was with the team called Ways to Wellbeing. Since then, the teams have split into two. We've got the Ways to Wellbeing team in York, and they take referrals from the hospital and community response teams and mental health. So the aim of that is to kind of keep people out of hospital, at home for longer, to stop, to prevent readmissions, and obviously most importantly to improve quality of life for people. And then there's my team, which we started in February 2020. So before I started this post, I was a link worker at York Medical Group, and I actually started in post a week and a half before lockdown, really. So yeah, so social prescribing has grown hugely during that time, and our teams are expanding and what have you. So with the primary care link workers, we are based across all of the surgeries in York, so the 4 primary care networks in York, and we're based in the surgeries but also out into the community. And people that can refer to us are the GP staff, adult social care, local area coordinators, some mental health service, but also we do take self-referrals as well. So I'm more than happy perhaps to send an email over to Sue with our telephone number on, and maybe just a few of the key points that we just discussed today. I could put the Marmot review in there and things for you, linked to that, if that would be helpful. So yeah, we obviously work in the primary care networks, but we're based at York CVS as well. And now that I'm team lead, I'm based at York CVS, which we're really closely embedded within the voluntary and charity sector, as well as statutory services, which is kind of, I've realised, without the voluntary sector and the communities, social prescribing wouldn't exist. During COVID, a lot of our work was, obviously because of the lockdown, was identifying people who were on their own, were self-shielding. We worked through a lot of the lists just from the surgeries, just making sure that people kind of had food and medicines right at the beginning of it. And then quite a lot of our work was just weekly calls to people, sometimes calls a couple of times a week. The feedback that we got from that was that it was really reassuring, because people felt like they could be forgotten about, but knowing that they had the link with the link worker to the GP and what have you was really helpful. We also supported when the vaccinations came in, we support people in helping to book them, because obviously a lot was sent out by text and people didn't have phones that could receive the text, so we help people to book them and also to arrange transport. As things are opening up now, we are kind of getting out into the communities more. We chat to people and kind of we work on a personalised care, what matters to me approach. So it's very much, sometimes social prescribing, the word prescribing, it's like, right, well, this is what you need to do, and we definitely don't work like that. It's more sitting, having a conversation with somebody. We get about an hour for initial appointments, which obviously is a lot longer than the GPs. So we can sit down and actually find out what's going on, what matters to somebody, what would they like to achieve, you know, looking at support networks and things. And then we go from there. And then our role is to kind of work with people for about 6 to 12 contacts, to find out what they'd like to do, if they need social support, if they would just like to get involved with the community, if they'd like to volunteer, a whole range of things, kind of help identify that and then support them in accessing it, whether it's to help them with the referral or to actually go to a group for the first time with them, which helps reduce a lot of the anxieties. Although I've said 6 to 12 weeks, obviously if we've got somebody who's got quite a lot going on, then obviously it's our own professional judgment of how long we work with people. Yeah, we also are now beginning to, as we're getting out into this community, because we're embedded in York CVS, if there are groups that maybe struggling to what would like funding and things, we can point people in the right direction. We can also help groups to establish kind of like procedures and things if it's needed. We also work really closely with, when we kind of refer to groups or charities, we work really closely and keep that relationship and communication open, because it's really important that, you know, the groups have capacity, that the people that we might be working with, it's, you know, an appropriate referral. So that's really important. Also, as part of our work is hopefully going to be identifying marginalised groups and being able to get out there in the community, just to make sure that people have access to healthcare. So as much as we're about working in the surgeries and working with the community, a lot of the time we can get, so say if somebody came to a group and it transpired that they hadn't had any healthcare, or they were nervous about registering with a GP or things like that, that's when we can work as well to kind of support them. I think you find sometimes, a lot of time, people that we work with have maybe been passed from pillar to post and they've lost that confidence. So we're there to kind of build that relationship and that trust back in, and help them to access healthcare. Yeah, so that's us in a nutshell. I've not gone on for 10 minutes, but obviously you can just ask me any questions.